Wealth.com. I'm Ron Tanner.
The views expressed on the following program do not necessarily reflect the views of Money Radio staff, management, or advertisers, and do not represent an offer to buy or sell any securities. Some interviews heard on this program may be sponsored by the participants. It's time for Health Futures with Cypress HomeCare Solutions, Bob Roth. This is Arizona's only show dedicated to providing you with expert advice on how to live a longer, healthier, and happier life. To learn more, call 602-264-8009. That's 602-264-8009. Now, here's your host, Bob Roth.
Good afternoon. You're listening to Health Futures, taking stock in you. I'm your host, Bob Roth, and it is Friday. And of course, indeed it's Friday. This is when our show comes to you, our listening audience, here at Money Radio Studios. It's hard to believe that this is the last Friday of February. Next Friday will be March 1st. And we are almost getting through 2019. Time is flying for sure. If you are a first-time listener to our show is about how our older adult population can live a healthier, happier life. And how do we do this? We bring extraordinary guests to the show. And today is no different. I'm going to just jump right into it. I've got a gentleman that's right across from me. He is a psychiatrist. His name is Dr. Martin Newman. He's the founder of Destiny Springs Healthcare, a brand new behavioral health hospital, inpatient and outpatient facility. Welcome to the show.
Well, thank you. It's nice being here.
It's good to have you here on the show, and I understand you're not new to radio. You've done radio before in your previous life.
Yes, that was many lives ago, actually.
Rock and roll.
Rock and roll.
Very cool.
Yeah, it was fun.
And you know what? This is fun, and I enjoy this because I'm able to bring incredible, meaningful content to our listening audience. This station has had me on now for 6 years. We've done about 270 shows.
That's awesome.
And if you go to our website at cypresshomecare.com, click on the media button, drop down 3, you'll see radio show. You can catch any one of those. And for our listening audience, you'll be able to catch this show probably a little bit later today if you miss any parts of this segment. And I don't want you to miss a whole lot because Destiny Springs Healthcare is doing some really extraordinary things. And as your website says, elevated care for elevated outcomes.
Right.
I want you, if you could, take a minute, tell us a little bit about this vision that you had. I know this isn't something that just came to be. You've been a practicing psychiatrist for some time. Yeah. Talk to us a little bit about Destiny Springs Healthcare.
It wasn't too long ago while I was going through training in New York where I realized that we could do a lot more for psychiatric mental health patients than what we were doing. We know that what we can do, however, what we are doing, there's a huge gap in. So what I wanted to do was try to close that gap between what we know we can do and what we've been doing. So with that came the inspiration to begin Destiny Springs Healthcare. At the time, I was the chief medical officer at Aurora Behavioral Health Systems. They do have 2 facilities here in Maricopa County and a bunch of other facilities throughout the West Coast. And back in 2014, I looked around and I said, there's a tremendous need here in Maricopa County. There was a shortage of beds, of course, for acute care mental health patients. And so we pulled together a feasibility study to basically confirm what I thought was going on. And it did.
There's a severe shortage.
Yeah, there was a severe shortage. And
even with your new community, there still is.
Yeah, there still is. Because the growth is pretty astounding here in Maricopa County, and it's hard to keep up with that growth.
It is.
Along with the baby boomer generation and the amount of people that are seeking health care, it was called for. So I put together a project that has now with the assistance of the City of Surprise. They've been tremendous in regards to helping us pull this together. We constructed this 90-bed facility, which includes outpatient care and 23-hour observation. And we finished construction, and we are now awaiting licensing, hoping that'll come around pretty soon, maybe a week or two.
Nice.
And we'll be able to open our doors and bring patients in and treat them accordingly. We're looking forward to it. It's really exciting.
Now, you're over there at 17300 North Dysart Road.
Right.
What are the big cross streets there?
It's Bell Road and Dysart.
Bell Road and Dysart.
Bell Road and Dysart. We are just a little east of Grand Avenue or 60.
Right.
Right there, just off of Bell and Dysart.
Yeah, I know one of my team members was there for the grand opening. And,
oh, really?
And she was quite impressed. With what you've built there.
That's fabulous.
Amazing.
That's good.
90 beds.
Yeah.
And I would venture to say, and I'm saying this to our listening audience, it won't take you long to fill them.
I don't think so. Most of the behavioral health facilities in Maricopa County are actually full.
Right.
So, we're looking forward to helping out those that are sitting in emergency rooms, in general hospitals, on med-surg floors, at home, and so on, that need treatment. We're here for them.
And are you specialized in geropsych? I mean, is it crossing the board? I mean, give me an idea of some of the,
Yeah, that's a good question.
Yeah, some of the things you're looking at.
We have, we'll be licensed to treat adolescents, which generally speaking starts at around the age of 13 to 17. However, our license will probably be able to cover 11 to 17. And then adults, and then our geriatric community. We have... the hospital is set up in units to handle age-specific treatment. So we have a whole gero unit in the hospital, which also includes medical surgical beds as well. So we'll be able to handle a little bit more medically compromised psychiatric patients than other behavioral health facilities in town. So with that, we're able to supply gases in there, IV, fluids, and other such things that other behavioral health hospitals will not do. So we're looking forward to doing that, too.
As I look at these new hospitals that are built, and obviously you put a lot of time and thought into this, and it wasn't something that you just snapped your fingers and put it together.
It would be nice if I could have.
I know. And after you get this done and God willing you're successful, I'd love to see you build more because we need more.
Yeah.
And especially as our population is growing.
I need to get some more sleep before I do that, though, if I can.
Well, my listening audience knows that sleep is not overrated.
No,
Trust me.
I hear you.
I just myself did something to improve my sleep, so we can talk a little bit about that offline.
Yeah, I'd like to hear that.
But as it relates to the facilities today, I think the thing that I'm most intrigued about is how sophisticated they are. So I would imagine you're not like picking up mattresses at Bedmart. You probably have Stryker beds.
We do. Yeah, exactly.
And for our listening audience, a Stryker bed is like a $20,000 to $30,000 investment.
That's right.
Those things are pretty intensive.
Yeah, the hospital is very sophisticated, and we've gone through the facility with a fine-tooth comb, and we're constantly walking the facility for safety catches, making sure that everything is where it's supposed to be. All the safety issues regarding psychiatric care are in place. It needs to be, there's very subtle safety issues in the hospital that you wouldn't see that have been put in place. And it's environmentally quite pleasing. It's open. There's a lot of natural lighting.
Nice.
The decor is contemporary, and there's plenty of room. A lot of facilities that have been built are very stingy when it comes to room and lighting and so on and so forth. We have thrown out the book, and part of the environmental issues is also contributes to care. So it's very important that those things were in place when we built the facility.
And I learn so much about that every day. Lighting is a big deal. Colors is a big deal.
Right.
Decor is a big deal, especially for wellness and getting better.
Oh, yeah, absolutely. And there's been there's been a trend towards prescription writing for environmental trips for people to get better. So more hiking, more park trips, more exercise, getting out a little bit more. So we've tried to incorporate a little bit more of that into the facility. And if you take a look at the outside of the facility, you'll see a lot of recreational areas and wide open spaces that we put into place to help with care.
Nice. Yeah. You know, I think we talked about it at the beginning of the show. It's Heart Health Month, so all of that contributes to heart health. And the more and more I think about, hearts, heart health leads to complete health.
Yeah, I know. I could use some more heart health after Valentine's Day.
Well, I got to tell you, Wes, it threw on a little bit of raindrops falling on my head. Nice. Very apropos. We're coming at you live from the Scottsdale Air Park. It is 39 degrees in Scottsdale. Hard to believe. Snow up on the mountains, rain here. We'll take it because in 2 or 3 months it's going to be belting 100 degrees.
I'm very appreciative there's no leaks in the ceiling in your studio here.
Thank goodness.
Yeah, I know. I hear you.
Dr. Martin, may I call you? Or Dr. Martin.
That's okay.
Dr. Newman, can I call you Martin?
Sure, why not?
All right, we're up against a break. We're down one segment. Okay. We got 3 more around. So
Fabulous.
Please stick around. We're going to be talking to Martin a little bit more about behavioral health and Destiny Springs Healthcare. We'll be right back.
Fabulous. Thank you.
Are you sick and tired of hearing, don't buy an annuity until you've spoken to the so-called experts? If so, call 800-957-5604, extension 200, to learn the concept of a principal-protected, low-cost, new generation annuity and the various options. Listen to Secured Financial Solutions every Monday and Thursday at 1 p.m. on this station to prevent a derailed retirement and from purchasing the wrong annuity, especially the high-risk, high-fee variable annuity and complex proprietary index annuities. Secured Financial Solutions will help you understand the difference between true stated guarantees and non-guaranteed returns. Call 800-957-5604, extension 200, and visit dreamretire.com.
Investment advisory services offered through Virtue Capital Management, LLC, VCM, and Registered Investment Advisor. VCM and Secured Financial Solutions, LLC are independent of each other. Annuities are insurance products backed by the financial strength and claims-paying ability of the insuring insurance company. Information provided is not intended as tax or legal advice and should not be relied on as such. You are encouraged to seek tax or legal advice from an independent professional.
Power Networking Group is a proud sponsor of the Power Networking Radio Hour. Hi, I'm Pat Larson, co-founder of the Power Networking Group. We are one of the most powerful and fastest growing small business networking groups in Pinal County, and now chapters are forming in Phoenix and Scottsdale too. Power Networking Group is a new way for small businesses to network and grow. And the best thing is that our networking events are free. That's right. If you own a home-based or brick-and-mortar business in Arizona and want to take advantage of monthly networking events, professional development workshops, speed networking, small business expos, and so much more, you should join Power Networking Group today. Give us a call at 888-432-8187 or visit us on Facebook at Power Networking Group or our website, powernetworkinggroup.org, for more information and start growing your business today.
At Farmers Insurance, the more you know, the better you can plan for what's ahead. Get smarter about your insurance at farmers.com. That's farmers.com.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress HomeCare Solutions, Bob Roth.
Welcome back. Wes, you're killing me here. A lot of rain songs, and I think they're very appropriate, so thank you very much.
I'm raining down on you.
Is that next?
Oh,
rain.
No.
Yeah, there you go. But
but
it's a little bit
different.
It is REIGN, but that's all right.
That's why
rain on me. But I like Who, man. The Who is awesome.
It is.
All right. Well, Wes, thank you very much.
You're welcome.
This is not a rock and roll station. This is Health Futures. But if it were rock and roll, my guest, Dr. Martin Newman, could take it over because he was a disc jockey back in the day, in the rock and roll day. But if you missed our first segment, I've got Dr. Martin Newman here in the studio. He's the founder of Destiny Springs Healthcare. He's a psychiatrist who had this great vision of creating a outpatient and inpatient hospital right here in the Valley. They are opening within probably the next 2 weeks. They got to get through the health survey.
Right.
But they're located right there on Dysart Road and Bell Road. Martin, you've taken me through a little bit of the layout of the facility. And before we go into our next topics, if you would, if you want to leave some lasting impressions with our audience in terms of what can they expect when they walk in that door to Destiny Springs.
Yeah, it's interesting. Yeah, it's interesting because there's been a paradigm that's been established over years regarding the treatment of behavioral health patients in acute care settings. And no one's actually taken the time to kind of push the envelope and do what you can to up the level of care, not only in terms of clinical, but also in terms of amenities and comfort and so on. So we really did it on this project, and I think you'll find that when people walk in to the lobby, bringing their loved ones to the facility, it's not going to be one of these things where, Johnny, I don't know if we really want to leave you here tonight. I've seen a lot of that. This is going to be more like, Johnny, have a nice time.
Right.
We'll be back tomorrow. Enjoy your stay. And they'll leave with the confidence knowing that their loved ones, whoever it might be, will be well taken care of. And it's almost a resort setting.
So it's not that sterile hospital
setting.
And you don't get that putrid ammonia urine scent. When
God, I hope not.
Yeah. No, listen, when you think about behavioral health hospitals, I mean, that's what I think about. Yeah. I think of One Flew Over Cuckoo's Nest. I mean, that's my generation.
Yeah, that's unfortunate.
It is.
Yeah, it's unfortunate. And even those that may not measure up to what we've done is nothing like that. But there's still so much more that could be done, and we're trying to achieve that here. Not only clinically, but also in terms of the ambiance of the place, because the ambiance does add to healing.
I with behavioral health, and certainly it is a huge challenge for our community, and we read about it in the news every single day. We've got to get past this stigma.
Right.
And this is something this is the world you're in every single day. In the olden days, they used to whisper, don't talk to Uncle Eddie because he's maybe not all there. But, today, we're a little more open. We've come far, but we still have a long way to go, don't we?
Yeah, we do. I think that the conversation that's been taking place locally and in national media and folks and families and in educational facilities and universities have done a really good job in trying to get this out of the darkness. However, as you say, there is a lot more that needs to be done. And I'm hoping that the newer generations that are going to be replacing us soon enough will be able to, carry that flag and improve the opinions, you might say, of patients that carry mental health disease, so that we can treat them appropriately. And I'm hoping also that in terms of science and research and new studies that are coming out and new types of medications and different types of treatment will also help with that as well, because there still is a lot of issues regarding medications and things like that that are being utilized for mental health patients. And we're trying to expand that more holistically, so we use different alternatives as well as the standard pharmaceutical agents and other types of treatments at the facility too.
So I'm a benefactor to the Jewish Family and Children's Service Organization here. And we do our Big Brighter Tomorrow luncheon. We just did it about 3 or 4 weeks ago.
Mm-hmm.
And one of the statistics that Dr. Laurie Henderson put forth, and when he opened up his conversation, 1 in 5.
Yeah.
1 in 5 adults in our country have some type of behavioral health challenge.
Sure.
And you know what? I think we need to realize that as a society that it's not a bad thing, and you can get help.
Yeah.
And help is right around the corner.
Yeah. And it's interesting because a lot of people don't understand is that mental health disorders typically cover a spectrum of functionality, you might say.
Mm-hmm.
There's lots and lots of people walking around with anxiety. But that doesn't necessarily mean it should or does create a deterioration in functioning. They just seem to ride out the turbulence every so often. Same thing with depression and personality disorders, levels of addiction, whether it be behavioral type or chemical types of addiction, things like that. So the treatment that we offer are for those that are on that far end of the spectrum. And the terminology and semantics of behavioral health care are laced within society. We talk to people all the time about being depressed, and the truth of the matter is they're just typically sad. Talking about what may be going on with you or meeting with a counselor doesn't necessarily mean that you need admission to an acute care facility. But seeking out those kinds of things is always helpful, and it improves your level of functioning. When someone has severe mental health disease, we're there to help them and help improve their level of functioning. So people mix up some of the semantics all the time, and that's why people have this issue with the stigma. One of the reasons why they have an issue with the stigma with mental health care is because they use the terminology day in and day out, and they're not quite sophisticated in regards to the true disorders, you might say, that need serious treatment, such as Alzheimer's and dementia, other types of depression within a family.
Well, I remember the other statistic that they gave. 1 in 5, but half of them go untreated. They don't.
That's right.
And the challenge is that, if you're listening in and you are a loved one of someone that you love and care about, that you feel may have some behavioral challenges,
right,
need to get them in to see their PCP.
Oh, it
starts with their
absolutely.
primary care physician, and then go from there.
Yeah, there's been more demands for primary care physicians to screen for mental health disease, mental health disorders, whatever it might be, and it's a good thing.
Yeah, we need to do more of that.
Oh, yeah, I agree.
You hear the music? I'm not
do.
sure our listening audience can, but
I hear
they'll hear in a little bit.
I like it.
Yeah, I like it too.
Good choice.
While it's not the RAIN, it is rain. So, Wes, you are hitting it on every single note. You're scoring big time with us. You've been listening to Health Futures Taking Stock in You. I'm your host, Bob Roth. I've got Dr. Martin Newman here in the studio. He's the founder of Destiny Springs Healthcare. Stick around. We got 2 more segments coming. We're going to learn more about Destiny Healthcare, or Destiny Springs Healthcare.
That's a mouthful.
It is a mouthful. But stick around. We'll be right back.
As we reach the bottom of the hour, we pause for a look at the world's news. Then we're back with Money Talk. We're Money Radio 1510 AM and 105.3 FM.
Singer R. Kelly has been indicted in Cook County, Illinois, on charges of aggravated sexual abuse. Correspondent Sarah Seidner's in Chicago.
Last week, attorney Michael Avenatti was able to hand over a tape to the state's attorney's office here in Chicago. And indeed, the Cook County State's Attorney's Office, as we understand it now from 2 sources, has indicted R. Kelly.
Kelly has settled a number of sexual abuse claims out of court. New England Patriots owner Robert Kraft is facing prostitution charges in Florida. Correspondent Anthony Costura on what police claim.
He was involved not just once, but twice, soliciting sex at a local spa here in Jupiter, Florida.
Kraft has denied all wrongdoing. A California prosecutor says the parents who shackled some of their 13 kids to beds and starved them will be spending up to life in prison. David and Louise Turpin pleaded guilty today. I'm Mike Moss.
If you have hard water, the lime scale not only leaves white spots, it clogs pipes and breaks down appliances, costing you hundreds of dollars in energy and wear. Eliminate lime scale and other water issues like brown staining, bad odors, and lead with HydroCare water products available from Wave Home Solutions. Wave's affordable systems don't use salts or chemicals. You'll love the way your water tastes, smells, and looks. Satisfaction guaranteed. For more information, go to WaveBestWater.com. That's WaveBestWater.com.
Introducing new life-proof, slip-resistant wood-look porcelain tile from the Home Depot. Starting at just $1.99 a square foot, it's 50% more slip-resistant than ordinary tile. It's waterproof, stain-proof, scratch-resistant, and works indoors or out. Step confidently in your kitchen, bathroom, patio, or any area of your home with new life-proof, slip-resistant porcelain tile. Just $1.99 a square foot. Only at the Home Depot. More saving. More doing. Selection varies by store. Slip resistance based on tiles that meet a DCOF less than or equal to 0.42.
There are many who call themselves money experts. You're listening to Money Radio, a quarter century of bringing you the best in money experts every day.
Hi, I'm David Bach, the creator of a brand new retirement seminar for couples only. It's called Smart Couples, Smart Retirement, the Retirement Seminar, and it's based on my #1 national best-selling book, Smart Couples Finish Rich. If you're a couple planning for retirement or already retired, this seminar has been designed for you. Come learn how to reach for the retirement you deserve together. My seminar is now previewing locally, hosted by one of the first financial advisors in the country I've approved to offer it.
Excited? Join Nancy Fleming, a financial advisor in East Valley, as she's been authorized to host the Smart Couples Smart Retirement Seminar. For more information or to register for this important event, call 480-632-8770. That's 480-632-8770. Or text RETIRE to 33222. That's RETIRE to 33222. Nancy Fleming offers investment advisory services through Fleming Financial Services. David Bach is a co-founder and part owner of AE Wealth Management.
Put your business front and center with hundreds of Money Radio listeners at our annual Financial Fest. For more than 25 years, Financial Fest has offered anyone in the financial services industry an affordable and easy way to promote and showcase their services to these preferred and qualified attendees. Admission, as always, is absolutely free. Financial Fest is Saturday, March 16th at the Embassy Suites Scottsdale Conference Center from 8 a.m. to 4 p.m., and space is filling up fast. Reserve your booth and presentation opportunity today. Visit financialfest.com or call 602-424-5030.
Are you purchasing a home or looking to refinance? Confused about mortgages or the process of getting a mortgage? You're in luck. Joe Capitano, Senior Vice President with Homeowners Financial Group, will bring his 27 years of experience specifically to coach and educate you. Listen every Wednesday at 1 p.m. for his extensive knowledge in terms you will understand. Welcome Joe and the JoeLoans.com Hour. Online at JoeLoans.com. That's JoeLoans.com.
You might not be able to get a new car with your tax refund, but you can make your car feel like it's brand new. Come into Mako today and get your dream paint job during their tax season sales event.
I'm Jim Chesko with Your Money Now. Wall Street continues to hold solid gains. The Dow Jones Industrial Average up 151 points currently. The Nasdaq's up 56. The S&P 500 has gained 14. Oil futures are modestly higher near the close. April crude is up 34 cents at $57.30 a barrel. Word out of Chicago today that R&B star R. Kelly has been indicted on charges of 10 counts of aggravated criminal sexual abuse. The Chicago Sun-Times says the charges stem from a newly discovered video found by attorney Michael Avenatti that allegedly shows Kelly having sex with a 14-year-old girl. The singer's first court date is March 8th. Universal and DreamWorks Animation are predicting an opening weekend take of at least $40 million for How to Train Your Dragon 3, The Hidden World. The final entry in the Dragon trilogy is expected to rule the weekend box office. The only other film opening in wide release is MGM's wrestling comedy drama Fighting with My Family, which is projected to bring in $7 to $10 million. That's Your Money Now.
If this were just any door, and this were just any ignition, connected to just any transmission, in just any vehicle, then perhaps it would be okay to buy it from just anyone. But this is not just any car. It's a certified pre-owned Mercedes-Benz. Every detail has been inspected and road tested by highly skilled Mercedes-Benz technicians. And it's all backed by an unlimited mileage warranty for up to 5 years, which makes the decision of where to buy one simple. Your authorized Mercedes-Benz dealer. The certified pre-owned sales event going on now through February 28th. Come in today and we'll help cover your first month's payment. Offer available through Mercedes-Benz Financial Services. Because in the end, it's absolute confidence in genuine Mercedes-Benz parts, or it isn't. It's either Mercedes-Benz certified pre-owned, or it isn't.
See your authorized Mercedes-Benz dealer for complete details and limitations on credit towards your first month's payment and certified pre-owned warranties.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress HomeCare Solutions, Bob Roth.
Welcome back. You're listening to Health Futures. I'm your host, Bob Roth, and we are on our third segment, being brought in by a little sweet baby James, so thank you very much. I'll tell you what, Wes, you're hitting it all today. Hitting it out of the park.
Thank you.
Nice. Very, very nice. Sunny days, and that's something we could all use. So we're on our third segment, and if you're just tuning in, I've got Dr. Martin Newman here in the studio. He is the founder of Destiny Springs Healthcare. If you missed the first two segments, go up to our website at cypresshomecare.com. Click on the media button up on the top. Third button down is radio show. You'll be able to catch this a little bit later today. You'll catch those first two segments that you missed, and obviously these next two. You know, during the break, Martin and I were talking about being a clinician as well as being an entrepreneur.
Right.
And that's not something that's real easy to do as a practicing psychiatrist, is it?
No. Wearing a couple of hats like that has got its advantages, and it also has some of problems in regards to time and investment of time and so on. And I had clinical responsibilities during the period of time I was putting this project together. Visiting a number of hospitals around town, doing consults for other physicians, and had my own private practice as well. And then about 6 to 7 months ago, I had to back out of all that because this was dragging me away.
Right.
So I'm looking forward to getting back onto the clinical side again as well.
Well, you're just a couple weeks away?
I hope so.
A couple weeks away.
Yep.
For our listening audience, if you wouldn't mind, I know you don't like talking about yourself, but you're at this pinnacle now, about to open up psychiatric hospital, behavioral health hospital, inpatient and outpatient. Can you share with us a little bit about your background?
I'm leaving now.
You're leaving now?
No, we're done.
90 seconds or less. I know you're a New Yorker.
Yes.
So you're
Can you tell from my my accent?
Your demeanor. You're like, I'm leaving right now.
Yeah. A little edgy, huh?
A little edgy. New Yorkers, they always tell you like it is.
Exactly. I attended undergraduate school here at ASU and majored in microbiology. So I got my bachelor's degree in microbiology and then moved off to Drexel University, which it's called Drexel University today. It used to be called MCP Hahnemann University in Philadelphia.
I remember that.
Back then. And I attended medical school there. After that, my residency and training took place in New York City at Columbia University and St. Luke's Roosevelt Hospitals in Manhattan. That was a good training site over there.
I would imagine.
That was very good. And ultimately came back to Arizona. It's hard to leave here. I've been here for a number of years. I've traveled around a lot, but I've always returned here and have a great fondness for Arizona. It's a beautiful place to be. Except for today.
Well, we'll
get there.
It's up to 42 degrees.
Yeah,
now.
we're getting there. We're
go.
climbing fast. So I was at U of A, on faculty at U of A for a short period of time, and then moved back out here to Phoenix. And I'm happy I'm here. And I hope other people are happy. I'm happy.
Well, I'm happy you're here in the studio and really talking about what you're doing. And really what's my passion, as you know, is caring for the older adults in our community. And, you know, I really would love for you to really share with our audience, you know, what are some of the common psychiatric disorders in older adults that you're seeing?
Yeah. Aside from the common knowledge that people have in regards to dementia, there are, as you know, there's many different types of dementia that can be seen. You have your general senile dementia, which is just coming from old age and so on, and that's fairly common. You've got Alzheimer's, which everybody talks about, and so on. There are others, such as dementias that are caused by issues surrounding alcohol and addiction. So alcohol-induced dementia is not uncommon either, especially after a number of years of drinking and imbibing many different types of beverages, you might say. And that can take its toll on an individual over time as well. You've got things such as traumatic brain injury, multiple hits to the head, and other kinds of things that can create cognitive dysfunction in individuals as well. When it comes to psychiatric disorders, I mean, depression is probably the biggest issue when it comes to the elderly. That can be situational, compounded by environmental issues and multiple medical conditions as well. The elderly also take a lot of medications.
They do.
They do. And I hate using big words, but I guess, and iatrogenic is a term that is utilized a lot because of physician or caretaker influences in regards to induce psychiatric or mimic psychiatric disorders because of a multitude of medications that they may be taking that could actually affect their cognitive functioning as well as their emotional well-being too. Lots of steroids and things like that they would be taking for inflammatory issues can create chaos.
Sure.
Yeah.
You've hit on so many things here. And Martin, you know, first and foremost, you talk about alcoholism, and we've talked about it here on this show.
Yeah.
It is something that, you know, enough people aren't talking about with our older adult population.
Right.
And it is, you know, the thing that our listening audience needs to really understand is that as we get older, we metabolize alcohol very differently.
Sure.
And, you know, the days where, you know, when I was in college, a long time ago, a really long time ago, you know, I could drink.
You look like you graduated college just a matter of like 4 or 5 years
ago. You're so kind.
And I like the color of your shirt. Of course, this is bad radio, but you need to see the color of your shirt.
There you go. Well, I appreciate that.
You're welcome.
You should see my socks too. But I will tell you, I mean, you know, back in the day, you know, I had 3 or 4 beers, 5 beers. It wouldn't be a big thing. But, you know, if you're 70 or 80 years old, you know, 3 or 4 or 5 beers is a lot because you metabolize that very differently.
Sure. Yep.
And then, you know, we have people that are taking medications, as you talked about, and then you mix alcohol.
Yeah, not a good thing.
That's a recipe for disaster.
It is. And the elderly also have a lot of issues surrounding pain. So you have arthritis, other types of degenerative disorders as you get older.
Right.
And to just try to resolve those kinds of things, if not handled by the proper caretaker or physician, can end up with addiction to opiate-type pain medications like Percocet, Darvon, and other kinds of things which really complicate the issue. And it does cause cognitive deterioration over time.
And they're self-medicating to try to get themselves out of that pain, for sure.
Absolutely.
You know, one of the things we talk also about the show, on the show, is we talk about depression. And we talk about the fact that, you know, we have so many older adults. And, you know, my listening audience has heard me say this before, but I'll repeat it. 1/3 of our population, 65 and older, lives home alone.
Right.
And in the next 10 years, they're saying that number could grow as much as 50%.
Yeah.
And, loneliness is a serious problem for our older generation.
That's right.
And so many of those, and the facts and figures have been published that loneliness is the equivalent of smoking 15 cigarettes a day.
Yeah.
And we've got to do something to help these people get engaged.
I think you're doing a great job too with your home health and things like that. That's fantastic.
Well, thank you.
Yeah.
But it's just the tip of the iceberg.
Right.
We need to do more.
Yeah.
And my appeal to our listening audience is if you have a neighbor, family member, friend that is home alone, you need to engage them.
Yeah.
Get them out. Get them, interacting with others.
Sure.
I mean, we as human beings, we crave that.
Yeah.
And we have older adults that are sitting at home that may not have any conversations with a live human being or touch for a week, 2 weeks, could go as long as a month.
Yeah, there's a number of, it doesn't take a lot to motivate somebody who is elderly to go visit their physician. And a lot of that is due to what you've just raised, and that is simply to sit down and have a healthy conversation with somebody. And they'd really take a look, they look forward to visiting monthly a physician to talk about their health, their well-being, and just have a general conversation. So you're absolutely correct.
And as we wind down the third segment, we also have a real problem with gambling addiction.
Yeah.
And a lot of these tribal casinos, older adults are going to because they're engaging with others.
Yeah.
And they don't quite understand where the pit boss is saying, "Hey, Mrs. Abramson, great to see you."
That's right.
It isn't about just really being great to see you. Great to see you. Bring your money.
Yeah, bring your money. Exactly.
Exactly. So we can do better. We can do a lot better.
Yeah. You can't be shopping on QVC all day long.
No, you can't.
No, you need more than that.
You've been listening to Health Futures, taking stock in you. We're down our third segment. We got one more. Stick around to hear Dr. Martin Newman and Bob Roth. We'll be right back.
And his beautiful shirt.
Thank you.
So stay with me and I'll have it made.
Are you sick and tired of hearing, "Don't buy an annuity until you've spoken to the so-called experts"? If so, call 800-957-5604, extension 200, to learn the concept of a principal-protected, low-cost, new generation annuity and the various options. Listen to Secured Financial Solutions every Monday and Thursday at 1 p.m. on this station to prevent a derailed retirement and from purchasing the wrong annuity, especially the high-risk, high-fee variable annuity and complex proprietary index annuities. Secured Financial Solutions will help you understand the difference between true stated guarantees and non-guaranteed returns. Call 800-957-5604, extension 200, and visit dreamretire.com.
Investment advisory services offered through Virtue Capital Management, LLC, VCM, and Registered Investment Advisor. VCM and Secured Financial Solutions, LLC are independent of each other. Annuities are insurance products, backed by the financial strength and claims-paying ability of the insuring insurance company. Information provided is not intended as tax or legal advice and should not be relied on as such. You are encouraged to seek tax or legal advice from an independent professional.
Dad, what are you doing?
I thought you said you wanted everyone's names in all the team ball caps.
Yeah, but not with permanent marker and my dad's terrible handwriting.
Johnson, what is in your shirt pocket?
My interpretation of our company logo with a red magic marker. I have a big meeting and I want to advertise our brand.
Time for professional-looking logos.
Showcase your brand the right way. Embroider Me of Scottsdale will put your logo on practically anything you can think of to promote your business. Hats, shirts, bags, pens, cups, gifts, unique and specialty items, conference and branded apparel, and so much more. Visit the Scottsdale showroom on 64th and Bell Road, and our branding experts will make your business stand out. Embroidery, screen printing, anything you want to put your logo on. Promote your brand the right way with Embroider Me of Scottsdale. Learn more now. Search Embroider Me Scottsdale or call 480-998-9199. That's 480-998-9199. Or search Embroider Me Scottsdale on your mobile phone right now.
Are you hiring? With Indeed, you can post a job in minutes, set up screener questions, then zero in on qualified candidates in an online dashboard. Get started at Indeed.com/hire.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, Call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You, and it is Cowbell Friday. Thank you. Thank you, Wes. A little lover boy working for the weekend. You know, we're working for the weekend, and it's back to 40 degrees out. But we don't care because we live in a great place like Arizona.
It's going to be sweltering today, I guarantee.
It'll be sweltering at some point in time.
Somewhere, not here.
Not today. You know, if you're just tuning in, I've got Dr. Martin Newman. He is the founder of Destiny Springs Healthcare. He's a psychiatrist, been a practicing psychiatrist for a number of years now. And this has been a vision of his to create a both inpatient and outpatient behavioral health facility. It's a behavioral health hospital. If you want to learn more about it, go to destinysprings.com or you can call 623-233-3000. So we need more of these places in our community. We know Maricopa County's growing.
Right.
You are innovative, and you did a great job in our first and second segment describing your hospital and how it's different. I want to, just really talk about some of the other differentiation that you're going to be doing relative to what others might be able to find there. Especially, you have this whole outpatient piece, too.
Right.
So if you wouldn't mind, I want to leave on talking about what we started talking about at the beginning.
We have our inpatient services include specialty care on the medical side as well as the psychiatric side. And I try to integrate these. I mean, people talk about integrated care all the time.
Right.
Yeah.
That's the big buzzword today.
It is. And a lot of people beat that to death, but don't actually do what they need to do to actually call it integrated care.
Right.
We have psychiatry, of course, but we also have cardiology. We specialists in cardiology. We have specialists in endocrinology and internal medicine, wound care, and so forth. We have cardiac telemetry in the hospital, along with nutrition and a full-time nutritionist and dietitian to help every single patient that is in that facility really tune up in regards to the type of nutrition that would be best for them. And I think that that's the key. When I say what's best for them is we focus in on the individual patient, and a lot of people toss that around just like they do integrated care. But to give you an example, for instance, a lot of facilities have visiting hours for patients, especially in behavioral health. They want to try to compartmentalize it to kind of make it more convenient for the facility rather than for the patient. So what I did is I flipped that on its head. And I've told our staff what we want to do is when we bring a patient in, the first thing we want to find out from that patient is what is best for their family and their friends to come visit them. And then we carve out time
Which makes sense.
during the day for them to go ahead and see family members and loved ones and friends during that time. So it's convenient. And then we go ahead and we build the treatment plan around that time for them. So that just gives you some insight to what we're trying to do when they first step in through the doors. In terms of specialties, even in our outpatient facility, we will conduct physical exams once a month on all the patients that are attending outpatient treatment, along with their groups and individual social work and psychiatric visits at our outpatient clinic as well. We're putting together a retail pharmacy so that patients can go ahead and get their medications before they even leave the hospital. So we know that they're getting the medications that have worked for them in the facility, and they're getting it delivered before they even leave the front doors. So these are the kinds of things that have been missing, and they're just small items.
And you mentioned at the top, too, you have some recreational stuff, too.
Oh, yeah. Yeah, we've got a number of activities throughout the day. We have a lot of outdoor areas for exercise. We have a full exercise gym. Inside, we have an indoor basketball court. Inside, we have an outside volleyball as well. Outside, we have walking tracks. We've got a number of specialties like equestrian therapy. We've got, of course, all the standard stuff that you would find in a behavioral health facility, on top of morning meditation and yoga and other kinds of things to help broaden the experience for patients that are at the hospital. So they can also integrate into their personality and their interests and take things with them when they leave to assist.
You've really thought about everything. So for our listening audience, you would think that this is like a hotel and you'd want to stay there.
Actually, I wouldn't mind.
But it's only a 7 to 10 day stay, right?
Typically, an average length of stay is around 7 to 10 days.
7 to 10 days. Payer sources are?
Everybody.
Yeah. So you accept Medicare, you accept all the health plans or private pay.
Yeah, we will. As I mentioned earlier, we're going to be going through our licensing process pretty soon. Once we get that in place, we'll be able to take all of the commercial payers, and then when we go through our joint commission survey and accreditation along with Medicare or CMS, it's called, we'll be able to accept Medicare and Medicaid or access after that point, and that shouldn't be too far down the road.
Nice.
Yeah.
Nice. So, as I look at this, this is an extremely extraordinary vision that you had. You built it. Trust me, they definitely will come.
Yeah.
Again, I want to just give this out to our listening audience, DestinySprings.com, 623-233-3000, 90-bed community with lots of things to offer. It is really, truly incredible.
If you want to come by, shoot some hoops with me anytime.
I'd like to.
Doors open.
I'd like to. I'll wear my shirt and my socks. I promise.
Awesome.
So any lasting comments that you want to leave our listening audience?
If loved ones, family members, you see any changes in cognitive behavior, see anything emotional that doesn't look right, I would suggest going to your primary care physician, have them screen them accordingly. It may not be anything serious, but it's better to get in front of it. And if they do need care, there's plenty of providers in the community to help them get through this.
Start with your primary care physician.
That's right.
You've been listening to Health Futures, Taking Stock in You. We're done our show. Dr. Martin Newman, thank you very much. Founder of Destiny Springs Healthcare. Make it a great day. Have a great weekend.
Yeah, stay dry today. Thank you.
Thank you.
To Bob Roth's Health Futures. If you have questions about your own or your loved one's future health care, call Cypress HomeCare Solutions at 602-264-8009. That's 602-264-8009. Or visit CypressHomeCare.com. Be sure to join Health Futures with Bob Roth every Friday at noon, right here on Money Radio 1510 and 105.3 FM.
Financial words of wisdom with Market Wrap host Mo Ansari.
Staying out of the market is the most dangerous thing you can do for your financial future.
If you continue to spend like a drunken sailor, you're going to run out of money. That's the reality. This is not poker. This is your financial future.
It's helpful financial food for thought on your drive home with a host who tells it like it is. Market Wrap with Mo Ansari.
Catch Market Wrap on Money Radio 1510 and 105.3 Monday through Friday at 5 p.m.
Money Radio 1510
and 105.3 FM.
KFNN Mesa, Phoenix, and K287BX Mesa. No matter what the temperature is, even if it is super chilly out, it's always cool to be in total charge of your finances. Money Radio will tell you how. Take a look at the market. Dow up 86 points at 25,936. S&P up 8 at 2783, and NASDAQ up 36 points at 7496.
Talk about money. This is the place they come to. And there's more on the way after this break for the latest news. And we begin now.